Good evening. My name is Laurel Norville, the Chair for Board of Health. It is October 26th. We're starting just a little bit late. It's 6:36. Present at the meeting are myself, Elaine Silva, and Dennis Linehan, with our Health Inspector Dan Thompson. Our health director is on the way, and we have members from the house here, and their names will be put into the record. At this moment, since we're waiting on our health director, we'll check on the minutes. I'm going to motion to accept the minutes of the October 18th meeting. I second that. Any concerns about the minutes? No, good to me. Everyone, Cindy, as always. Seeing no comments. Can I have a vote on the minutes? Linehan, aye. Silver, aye. Orville, aye. Dan, you feel comfortable starting? Should we introduce everybody? Sorry, yes. Why don't we start with the room? Yes, absolutely. So on the chair, are you acting as interpreter?
No, it's not verbal.
Okay, do we have it?
He's the buyer, no, go ahead.
So you're the buyer?
My mom is okay.
Okay.
He's my friend, not a buyer.
Okay, can you manage the language tonight?
Yeah, that's okay. He understands.
You're okay? Okay, 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 good. And your names for the record?
My name is Supreme.
Right, and your name? Sure, you with that?
Michael Tucker.
Nice to meet you. Thank you for coming. What we'll do is we'll have Dan present. Oh, I'm sorry. We have Melissa on board. Sue Heffernan. Does anybody want to introduce themselves, or are there any public comment from the Zoom room?
No.
Okay, thank you. Seeing none, why don't we go forward with your presentation? Sure. Then, as soon as Anthony comes, he'll be able to go on this. Okay.
Sure. Yeah. So we're here tonight to discuss the status of Bamboo House and their permit to operate as a restaurant. I started inspecting Bamboo House. The first time was September 28th of 2022, so a little over a year ago. And from the beginning, there were many issues identified with all different facets of food safety, general sanitation, and it's been an uphill battle the entire time. There was a short period of time where there was a bit of improvement, but not generally anything that was significant. A lot of the issues that we have seen, which are noted in all these inspection reports that we have, are knowledge based and education based. So it's difficult to kind of just have like a one size fits all answer to this sort of thing. And it takes a lot of effort on the operators, the owners, their end to resolve these things, because at the end of the day, we're just trying to make sure that nobody's going to get sick. That's pretty much what it comes down to. So I'll save going through each and every report in detail about, you know, which critical violations are where and whatnot. But the main gist is, from our standpoint as the health department, we have inspected multiple times. So generally for their type of establishment being a risk-free, they're inspected 3 times a year, generally. Bamboo House, I've done 6 routine inspections, which is more than double what is expected of their risk type. And that does not include spot checks and repeat inspections to go in and check upon completion of the initial routines. So in total, I've probably inspected Bamboo House more than 10 or 11 times, which is a great amount of time for 1 year of inspections. Aside from myself inspecting, the most recent inspection report that I completed, which was on September 6th of this year, there was still a significant amount of issues that stemmed from all these different repeated violations. And Anthony and I felt the most necessary course of action was to be if they would hire a food consultant to try to bring in some more education and outside expertise, because ultimately we can't be there every single day to educate. So the consultant that they brought in was Mogen Solutions, is out of Leominster, and during that time that Mogen was brought in, they completed 4 separate inspection reports, one on the 28th of September, one on the 18th of September, the 11th of September, and the 7th. And each report shows no real sign of improvement, no real sign that what is happening is in the right direction. Mogen Solutions also, the operator Jin that was helping to do these inspections is fluent in Mandarin and Cantonese, so there was no language barrier as far as I know. Correct me if I'm wrong, but there shouldn't have been a language barrier between the two of you, so it's all information that should have been transferred pretty smoothly. And the point of that is, over 4 inspections in that month, there was no improvement. It was all inconsistent and all still the same repeated violations that we've seen within the last year. So when we're given this kind of circumstance where we have tried again to kind of help them up and improve as much as we see fit just to complete the minimum standards, the minimum expectations, when there's no improvement up to that level over such a long time, it puts us in a difficult position to maybe think about their permit status and if they should open or remain closed. So that's just from my point of view, what I've seen as the inspector. As of right now, I don't see them fit to open up again. I don't think that there's any real indication that they're going to do better if you give them another opportunity to open. The risk is pretty high that someone could get sick eating there because of it.
Did I hear that there's the property, the business is transferring?
Correct, yes, so they're in the process, I believe someone, you hear from the party that's potentially buying the property. Sorry? Just as an observer. Oh, that's right, but there is a party that's interested in purchasing. They've already gone through some of the legal pieces, going to town council, getting their license transferred. So it's a serious attempt to make a change.
Will they be opening the same type of restaurant or something different?
So actually, this is Sue Heffernan, and I'm speaking on behalf of the potential owner. I'm actually an attorney, and all of this is news to me. My client does not know anything about these inspections or reports that have occurred throughout 2023. And specifically when we were applying for a liquor license and one was approved for the town of Wakefield at the early October meeting, we did not know anything about the 4 inspections or the consultant in September.
Thank you, Sue.
Thanks.
Violations, mostly food storage, am I correct? That seems to be the main thing.
The repeat
storage, you know, on the counters.
So a lot of it has to do with proper food storage and protection, proper sanitization of equipment, food contact surfaces, proper hand washing procedures, proper glove wearing procedures, bare hand contact with key foods, things of that nature for the most part.
And I noticed that, the inspection in January of this year was just one violation. Was that when they hired the food consultant?
No, so they that inspection there was some improvement. You know, we saw that they cleaned up things initially, right? So when I did the inspection prior, it was about, I think it was a few days before I did that routine, and then the next one was a week later, and they had one violation.
So
And
it was a reinspection.
yeah, it was a reinspection, yeah, so that kind of shows that it's more of an education thing rather than them performing the duties, because if I tell them to clean, or if I tell you to clean this, fix this, right, that's a quick fix to doing things, but overall, over time, if you don't know how to run the restaurant, you don't know proper standard operating procedures and sanitary conditions, then it's just going to revert back to another 4, 5, 6 critical inspection. So.
This is Sue Heffernan. Is it possible to obtain copies of these reports?
Yeah, they're all public records, so we could give you a copy of it. Yep, absolutely.
Thank you.
Any other questions from the board to Dan?
So Dan, you closed them down, right? Am I correct? What was the date you did that again?
So October, I think it was the very beginning of October.
And when exactly is this supposed sale supposed to go through? There's no date, am I not correct?
So do you know if there's an exact date for when this business might sell?
So essentially, we were waiting to get approval from the town of Wakefield for a liquor license. And we do have that now. And it's possible to obtain approval for the liquor license from the Alcohol Beverage Commission. So that's in process. We heard that that's close. Thereafter, there would need to be a lease with the landlord and a purchase and sale agreement.
But it could be.
Would you like to speak to this?
Yeah, but now maybe they don't want to buy it.
You know, they
Yeah,
scared,
because they say if they buy it, they will have a lot of trouble.
You know, so 1 hour before they still call me. My lawyer say, you know, that you have a lot of trouble for the restaurant as yours, you know.
If
And
they buy it,
I close before they will close my restaurant, I tell you already. You know, if I can close, right, you cannot close my restaurant. If you close, right, everybody scared, right? If they go buy, right, they have trouble, who go buy it. I tell them already before, you know, right?
yeah, and
Yeah, that's
now,
why but you tell me, you don't tell to anybody. You tell me that day, right? But they know they can check. They know you check, oh, you have trouble, that's the day, you know. They know I don't want, they want to buy it, no. Because, you know, before they tell me, right, go do this one, right? Because before I almost sell already. I thought you guys half year already. But tonight now, you know, they do, which one they do that? Yeah. In the owner, you know, the lease, right? They don't gotta sign yet.
not
And for me and the seller buyer, they still don't sign yet, half year already.
yeah,
That's
and
why, you know, that
if we close, we don't have money to pay the rents.
you know, 1 month I want to pay out this 7,000. I do everything to
How
7,000.
much longer is your lease?
2 years.
2 more years.
2 more years on your lease?
Yeah, no, if they don't buy it, I still open, I still find somebody for sell that.
Yeah, we could.
Because I
open it
cannot
and
take care of
find
people, I know
another.
I cannot take care of people.
But
That's
if
why I
we
put it there.
close and then nobody could.
Yeah, because nobody can buy that. And then you have any trouble, you can go to church. Which one I need to face, I can go to face, that's okay. But anyway,
And we find a new worker because before it's the old man. We will tell them to do
Anybody
that
check?
and then they don't listen sometimes, then they don't work anymore and then we could hiring a new worker.
and then you can go to church. Which one I
A
need to
little bit
prepare.
younger, then they will work.
They're more receptive.
Yeah, before, no, I tell them, don't do like that, they say, okay, they still do it, you know, I cannot
Sometimes-
hide, you know. I tell them
Yeah.
already, but look, you know, they still do like that, you know.
Yeah, the older, and then we tell them, they don't change, and we can every time stay on bed to do. That's why, but now close and then they don't work anymore, then we could hire the new people more younger and then it will better than.
I think one of the problems is, you know, we haven't really seen another restaurant that has had a track record like this for this length of time.
Yeah.
I understand like a new worker or something, but just due to the nature of the sale that might be pending. Just over this year, we haven't seen even just a willingness to change. It's, like Dan said, there's some level of understanding when we go there and tell them these issues need to be fixed, but then there's no willingness to maintain that, knowing that there is sale imminent. That's kind of what these last 5 have shown me, is that even with the consultant who's there much more than we are, just because of capacity, we haven't seen that willingness to change. So it doesn't show me, that there is hope for that.
Did the consultant send a report or did they say anything to you? That's that one.
The most recent or most recent report for all the consultants.
Oh,
Yes. So they all are very similar findings to what my inspections were.
And just to clarify, and I think everyone knows this, but the status of the previous food permit at an establishment has no effect on the next establishment, right? So I think there was misunderstanding where, this food permit status would affect the next one. There is no carryover. If there's a new permit, new application, we consider that a blank slate.
Yeah. So I'm hearing what you're saying, is that you're worried because it's not as easy to sell something that's closed. However, our job is safety. And had there been some heating to, had there been an understanding and improvement this past year, because we've spent, we don't usually have to ever go into a restaurant that often. So our job, though we understand your need to have a business, our job is safety only of the community. So that's always a concern. Any other board?
We could get one more time to try, we could try that.
Hear you, but I think it speaks pretty loudly that there've been 4 inspections just in the month of September. And they were all almost the same. And I guess I'm wondering what would be different if you tried again.
But the different people, the work.
No, right now, open, I can stay here every day.
Yeah,
Because
and
I do something else, not every day over there.
Why didn't that
And I go
happen
to check,
before?
huh? Oh, no, I go to do something else. But sometimes I do something else, sometimes.
Yeah,
Because they don't need, sometimes they don't need that much people, sometimes I do all.
yeah, but now we could try more better, if we could change everything that you on the food, the safety, the one, if they sometimes dirty, we could change all new. Then some to remove the air some. And now those we could, if we can sell it, we could change everything new and then make it more better, best.
So you want to sell it, you're trying to sell it.
I still don't sell
Yeah,
it.
we still sell
But
it.
like this, I
And
cannot sell
now,
it.
maybe the one buyer, he say, in fact, the lawyer say buyer have a lot of trouble. They buy it, they don't work.
I see.
Maybe they don't buy it, so we.
Yeah, if right now they still need buyer, I don't know, if they don't want to buy it, So I think is that if they don't want to buy it, if you go inside, take a look, which one I need to do that, I can do that, everything you said, okay, and then I go open. If you said no, okay, I don't open.
Yeah.
So, if I open before, I can help, ask the help department, they go inside, take a look, which one trouble, which one I need to change, and then I go change it,
And
and
then
then
we mold the.
is it okay, and then I go open. You don't say no, okay, I don't open.
It's
So okay, and then,
sometimes too old and make it look bad, and then we could change or.
because then they saw, they
Do
open.
you have, so we have to separate the issues here. I understand as a business model, this is really challenging. We don't want you to get more in the hole and it's not a matter of things being shiny and new. It's a matter of understanding the rules of keeping food from getting, from being improperly stored. That's a human
Yeah.
behavior thing. It doesn't, I don't think we're talking about replacing any
Yeah.
anything to, it's about doing the work. So,
Yeah, we understand, but sometimes, we talk to the worker and then they don't care, so we tell them to do that and then sometimes they don't hear,
that's-
say,
and
okay,
that's-
and then they don't.
and
do
that's
it.
that's what Candace is just asking. How is it gonna be different?
Well, then now I can go inside, take a look.
So we could,
I can find on more people, like.
we could try to train them better.
I think they're trying to say,
Yeah.
your staff, I guess, but
Yeah,
I mean,
I hear that.
I think what's challenging is you have to, like you said before, like you could spend more time in the kitchen, but you could spend more time because you know the stuff, but that should have been happening like 6 months ago. That should have happened like 4 months ago. It's you spending more time in the kitchen. But I know you're busy. There's a lot of other parts of the restaurant to run, but if you know everything, then you need to be back there, right? And you need to be watching.
It just,
Something happen.
But no, this like,
Yeah, we, the fun, outside people, we both stay in the kitchen.
yeah, my mom always inside, not inside.
who owns the restaurant? You own the restaurant. How many years have you owned it?
3 years.
So we're really 3 years ago, what were the inspections? You've been inspecting it for 2 years.
Just about, well, the first inspection I did was just over a year ago. Did you work at Bamboo House before you purchased it?
Oh, no.
No, okay.
In the inspection reports, we can find the previous ones, but
I have the previous ones.
Oh, you do?
Yeah, they're all.
They look very similar. They look like.
Well, I'll tell you what you're inclined to do.
That's, yeah.
You know, my thing is if that you own that restaurant, okay? Who's the manager there? Who's in charge? Okay? When you're working there, and even though you ask your employee to do something that you know could be a potential health hazard, all you have to do is it's only the tip of the pencil that is wrong, a piece of meat or something, and that goes in, and you can end up with 20 or 30 people sick. Somebody gets sick,
I know.
it's gonna come back, okay? But you as a manager are responsible for your workers, so if your worker isn't doing anything, then you should be right behind them, saying to them, no, this is the way to do it. Watch me do it, and you do it at the same time, and you teach them.
Okay.
And if they're not able to do
Yeah.
that, then they shouldn't be working for you, because this is a huge responsibility. I mean, there are people in our community that if they get sick from any of these foodborne illnesses, they could die. And this, I'm looking at piles of reports here, so I know this is not the first time that this has been explained. I'm feeling concerned that there's not like a true motivation to make a difference here.
It's no manager type of thing, you know what I mean? Not like I say, when somebody doesn't do anything wrong, you know, go in there. And you say to them, that's not wrong, it's gotta be cleaned, this is the way you do it, watch me do it. And then you watch them and you make them do that, and you make sure that that's done every single time they're in that building and every time you're open.
It's a tricky situation, just because they're saying two things here. They're saying
Yeah.
if they don't end
Yeah.
up selling, they're gonna stay
Right.
open. If they don't stay open, they can't sell, but at the same time, I think the only thing stopping us here is that it's not necessarily true that if you don't stay open, you can't sell, you can still sell.
Still sell, but I know they have. a
But if
lease that would be
they buy
something.
it, they have any trouble?
Well,
No, they have to start all
Yeah.
new.
So when
They
they,
start
they-
all-
None of this matters for the new buyer.
when they buy it new, it's,
They become-
everything's clean, like
Yes,
it's.
because they call me, they say, lawyers say, if you buy it, they have a lot of trouble.
So what the lawyer's probably trying to say is that the physical facility, when someone new buys it, we have standards of the physical facility, like the actual restaurant, the actual building.
Like the walls.
It needs to be brought up to a certain standard, but that is not because of these reports. These reports have nothing to do with that. That's just, they have to spend money to bring it up to a certain level. when a new restaurant opens, but these reports don't follow them. There's
So
no.
it sounds like if somebody is telling you that this could get in the way of your sale, that's not correct.
Yes, this has nothing to do with your sale. If you sell it, it's the brand new person comes in.
But
it's
right now,
the-
yeah, I know, but right now we're talking about is if they don't want to buy that, how can I do? So close here 2 years, and then this is 2 years. Yeah, they must money, you take the,
Landlord on the lease.
Yeah, so, right, so. We can't speak to that on the Board of Health. Like, our only job is to understand infections and risk to the community. We can't get involved on the business side of anything. We are understanding what you're saying. What business owners and restaurants all realize is that they have to go in and they have to make a new plan and they need to get a new permit, the new owner. You can't close it, Anthony.
Let's do it. Oh,
You can't set up a meeting. I know. So at any rate, we have to like focus on what have we seen in this past year and are we still concerned? And do we feel confident that this won't happen again? And I'm not feeling very confident. I'm not hearing a confidence from the board. I know you're asking, for one more chance, but most restaurant owners on the very first inspection get it right. This has been multiple times, so we're seeing, even if you got new employees, where it seems too difficult to do it. Have you owned any other restaurants? Yeah, so
so
this,
before we do the some
Where we were before in the supermarket sushi bar.
yeah,
Oh, they did sushi.
yeah. Because it's a small space, easy clean, Yes.
so sushi is even more dangerous, so.
I worry that this isn't being taken seriously enough, like this. I think, like, we're not here so that you can shine up the restaurant and get it sold. We're here because this is a risk to public health and it hasn't been either really appreciated. It sounds like it's been explained clearly. I feel like it's just not quite being taken in, and I worry that if we allow this business to open again, that people are gonna get sick and that this is gonna continue with this.
Even with the consultant, you look, it's the
Yeah.
same violation over and over and over and over again with the food consultant. And normally, when people bring in a food consultant, you really do see a difference in it. They really learn, they take that educational piece. But to me, you're just going back and doing the same thing before the food consultant come in.
I mean, in most cases, correct me if I'm wrong, the food consultant is like one of the last steps,
Yeah.
right? Like
well, it's-
opportunities were given for the restaurant to make corrections on their own, perhaps several times, and then we move to the food consultant. And then I'm looking at 4 inspections from the food consultant in the month of September here.
It's not all same.
Similar.
They're almost exactly the same, yeah.
Biggest thing is the food not being stored at the proper temperature and the proper.
And I see in one of the last ones, there's not a sink to wash their hands.
Yeah, that's.
Okay.
They do have a hand washing thing, but
There's no bodily fluid cleaning procedure, pardon me.
Oh, yeah.
Procedure on there, so
They
they
have the old one, not the new one didn't buy.
It mentions that eggshells with cracked observed shell eggs with cracked shells stored in the bin with the bean sprouts.
Right.
The biggest things that I noticed are potential cross-contamination and handling of ready-to-eat foods with bare hand contact and just general sanitation of equipment and food contact surfaces. Those are pretty much the heavy hitters that I see every time.
And like preparing food in the dining room, not in the kitchen.
Yeah, it opened to different sources of contamination and adulteration through that way, yeah. Just preparing green beans on a table that's close to a bunch of nail polish or paintings and little other things.
Not in the kitchen.
Not in the kitchen, not,
And I see some evidence of rodents and pests.
That's been persistent too.
yes.
Screens, doors, animals to get in.
And I understand there's some like trouble with the building also, just the integrity of the building.
Yeah, I mean, I've been extremely lenient, where I haven't even really been strict about the physical facilities. Because if they were to sell, and a new owner was to buy and start up another restaurant, the plan review process for that kitchen would be very in-depth, you know, with new walls, floors, ceilings, bunch of new equipment. There's a lot of work that needs to be done in the physical facility. So this isn't even.
But but in the whole suite, like there's another restaurant in
It's
that
true,
suite
yeah.
that
Yes.
not have an issue with.
Yeah, well, not to this extent, no.
It's all owned by one owner, that whole strip mall, and these people all have leases, these
Yeah.
restaurants that are in there, right?
It was the same one.
I think it's the same owner, yeah.
Yes.
Okay, thank you.
You can make a motion, I'm gonna introduce a few words, right? Go ahead, put the word.
So I could make a motion to deny the appeal to reopen?
That's what you were, yeah. I'll second that motion, and just to make sure that it is put in the record that this will not interfere with the sale.
Well,
Well,
This-
they can sell, if that
this-
person wants to buy it,
this
they can buy
record,
it.
yes,
Yeah.
this record
The
does
food
not have,
Yeah, this
the
would not
the
have
food inspection does not
have
have.
anything to do with that, so. And I'll second her motion.
Okay. All in favor?
Silver eye.
Orville, aye. So we have denied your appeal. It's just not wise. So.
Không, nếu là bạn như nào cũng như hiện tại thì muốn
You guys have any other questions or?
So we sell is no problem. Then you
This
can-
food inspection should not interfere with the sale of your business. There may be other things that aren't related to what we're talking to tonight, but what we discussed tonight should not impact.
It doesn't carry over.
The sale
Everyone starts
to an
new.
owner.
Okay, because some, the buyer, they care about the health.
They do, and they should feel good in that we have excellent health inspectors who are very fair and very good at educating in the process. And very proud of our inspectional services. I hope that that is relayed to anybody, but your operations have been, you know, we've been unable to make enough improvement to feel that it's safe for you to open. It has to do with your team, not the building, not the restaurant.
I think we can clarify with Sue, since Sue's a prospective, but the attorney for the prospective buyer. Sue, you heard all that, right? There's no
did.
impact on, okay, so there's no impact on the sale or on the next owner for these reports?
For your purposes, yes. I have to speak to my client because obviously this is new information. And then
That makes sense, yeah.
Yeah, and separate from the food inspection, I think you mentioned the physical site, walls, flooring, and that would impact getting a permit for a new restaurant owner to operate and a cost associated with that. So, but that's not for this board. Those are just separate
That's right.
issues.
Correct, yeah.
But I just wanted to be, you know, I don't want, you know, people to think that it's just the food inspection for the interference of sale.
Okay,
Yes, yeah.
we appreciate that. Thank you.
Yes.
So it's separate. It's separate. So we do wish you well, but it's not safe to reopen. And I hope that you can find a buyer soon, so.
Okay. Before I go, just go each, you buy it, no buy it, I go through the six years and years. You know, the half years, they usually buy the half years, you know, still is nothing.
No, but we weren't running the restaurant, right? So this is about running a restaurant. So we wish, we hope for a good resolution for you, but we won't be able to. we're all done with your appeal. You can stay if you want. We're not gonna talk about very many other things, but we're
Yes.
all done talking about this subject.
Would it be possible to speak to one of the inspectors to find copies of those reports or to contact them
Yes.
directly?
So we'll consider this kind of like a records request, so Cindy, our admin's here, she takes care of the records requests, so we'll put it together and we'll send it. Is there a specific place you'd like us to send it to? Or
I
you
can,
pick it up in
if you
person
get,
too.
if you give me a phone number, I can call directly tomorrow with that
Perfect.
information.
Yeah, we'll provide the, you have the number, Cindy.
Yep, so I'm at 781
Yes,
246
yes.
6375.
Thank you so much, Cindy.
Welcome.
Are you in the office tomorrow?
Yes, I am. We're
Thank
open till 12:30.
Okay, great.
No, I know, it's life has been great. Anything else to report, the director's report? I mean, we just saw you. What are you doing?
No, I was gonna say, I think, other inspections been going fine, we're hiring a new PhD coordinator, we did two interviews today. Sorry, PhD is the former grant that used to be here, the inspector grant.
Oh,
So now it's in Melrose, but it's still a regional grant, so we're all still part of it. We did 2 interviews with 2 candidates, very strong candidates, so we're lucky in that sense. We're likely to make an offer soon.
and have we've kept everyone who we've had? The team that's growing and learning, they're still with us. Or we were all
Yes,
like.
yes.
Okay, take good care. You can-
Thank you.
Yeah, so it's the same team, they got hired out, so, but. Yeah, so there's the same people, but our grant coordinator Hayes was gone about 3 months ago, 4 months ago. They moved on to a new position as a director of creative learning. They wanted to do, so very happy. We're trying to hire a new coordinator, this will be on the grants will allow us to hire an epidemiologist.
Oh, my.
For the recommendation of our esteemed MDPH. So we'll be hiring epidemiologists, we'll be
Can't wait to
hiring,
get that job description.
we've already got it written.
Yeah, you got it written. Is that gonna be posted soon?
Soon, the inspiration was taken from my previous position.
Oh.
So job description was hard to write.
Yeah.
This department's getting beyond me.
Yeah, it's a regional.
Up and coming.
It's a good one. And then we're also looking at a potential ad for a social service coordinator. So not all of our services are gonna be evenly distributed in the same way. Different communities have different needs. So based on what we've done here in Melrose, Stone and Winchester have thought the social service coordinator position that we've done here as well. So they're interested in piloting this program. So the state has given us the okay to go and hire a social service coordinator that could potentially be split half-time, half in Stone and half in Winchester. So that could be a pilot program for a year, see how that works out, but both somewhat smaller communities compared to us, so the half-time might be enough, depending on what the capacity is.
I don't know the need is that. So all of this movement is making me really wonder what we're gonna see. No, in fact, so the Globe did an excellent article a month or two ago about, how unique Massachusetts is in having individual boards, that in most other states, it's more county. And we've moved to, so, oh gosh, 14 years ago, we regionalized and that we were sort of sharing services. We have some fluidity. We have maintained an individual board for each town, which I maintain is important, but you still have these like you still have fiefdoms. And that's what I think people are trying to move away from in Massachusetts. So I'm wondering what this is gonna look like, even in town government and governance and how does this evolve? And I just wanna be ready, because I think I think sometimes we're like ahead on the demonstration projects. I think we've, you know, demonstrated incredible value in all the work we do, but then it's kind of like, where is this fitting in the big structure? So we keep talking about having a tri-board meeting.
Yes.
I think it's important that we get that on the books. I don't know if December is the best month, but you know, maybe January is a good time to start it, just to say, and I think we need to have a vision. And I wonder if we need to have the town administrators and mayor kind of at that meeting to go, so you guys, you know, because this regionalization has been happening on the admin side. It has not been happening from the boards. It's not the board's idea that, you know, we don't have that power. But in Wakefield, for instance, that's town council and town administrator. In Melrose, that was the mayor and city councilors, and I'm not, you know, Stoneham is similar as Wakefield. So I just want to make sure the boards remain relevant, but that we're part of the conversation. And, you know, so you all know, I had a conversation with Chair Chines the evening of the remembrance evening that we did a few weeks ago, and I just reminded him, or just you know, just requested that, you know, going forward, we're careful about my favorite t-shirt that is, you know, not about us without us, meaning there are a lot of things that impact us, but sometimes they're announced to us as a board and we're not given kind of I would appreciate a heads up, like, hey, what would you feel about this happening, as opposed to, we got this grant for you and here's the person. Like, it's a little, it feels a little funny, though it depends on what your interpretation is of the role of a board. Is the board simply look at a policy and decide what you think about it, or does the board have to do with the vision of what public health is? I mean, we have a very talented board in our town, I would say. We are packed with talent, and I just want us to not miss an opportunity while we're in, you know, I really feel like we're in this incredible growth phase, and I'm thankful for that, but I don't want to be in a position 5 years from now going, I wish we had thought of it differently. I think that we need to, and I don't know what the Mass Coalition is saying, but what, you know, like, I'm wondering if they're seeing, you know, it would be just interesting to see from them. You know, and that being said, I'm hoping for next year, but I'm gonna be watching. And I just feel like it would just keep
You are
growing.
going to see the change, because if you saw it, did you see DPH is instituting or going in and evaluating public health?
Yeah.
What has happened is, when I had that years ago, that review with the CDC, they were totally amazed of us, of our system here in Massachusetts, because it's so different than the whole country. And the whole trend is to go regionalized, okay? And we're probably one of the only people are totally amazed, but now I'm finding in the nursing aspect, there are a lot of cities and towns who have cut back, and a lot of using regional nurses. And there were a bunch of them at a meeting recently, and it really and truly was a little mind-boggling to listen to one new nurse that has 3 communities and what they were going through, because they had no idea and no one to fall back on. Whereas we do even in our regionalization, we have Melissa, but we have Sandy, and then we will have somebody else over in Stoneham. So we're planting somebody else in there, you know what I mean, to help. And you're gonna see the boards just as policy-making people, and the policies, I think we're gonna be called on to make more policy changes, much more.
Well, and it's, you know, so what I'm hearing is, you know, on one hand, we have fiscal restraint, you know, physical, you know, as you do in any kind of town thing. But while we're here in this growth phase, I think we need to pay attention to what is a best practice. And just always, you know, always balance that, you know, what's best practice versus, you know, hitting the next, whatever, you know, the next issue. So, you know, I mean, I've been, you know, so impressed with the growth and the work that we've done. I still contend that we're the most efficient. We represent the most efficient department in the town.
And we, when Anthony presented at our Mass Public Health Nurses Association meeting last year, he actually blew the minds of the people from DPH because him talking about just what it was like having two communities and what he was
And
doing
now
in the
three,
plans,
yeah.
and now they've heard that you have three, and now they're really like, oh, wow.
I think part of it is, and again, we can't be sure, but I think in 5 years, what we're gonna see is. They've already announced regionalization as kind of that future.
Yeah.
I think what we're lucky is we're kind of building it from the other side where other places have counties and the counties are representing their neighborhoods, they have representatives, that sort of stuff. I think the benefit of this is we're building the other way where we're coming together to form these units. And so each town, because they have independent boards, I see that as a strength. They are the ones that are the experts of their town, right? So if we're looking at like a 3-community thing in the future where it's a 3-person board and you have 1 person from each town, like that may not.
I am wondering if that's the model of the future. I don't know what I think about that.
I think this model as it is now, but and there's still tweaks to be made, but I think this, in the general sense of a independent board for each town seems right, because you also have your independent town council, you're independent.
Right,
So,
right. Well, we're volunteers, so there's no
Right.
fiscal restraint
That's
there,
correct.
that's true.
but I'll stop talking now, but
It's gonna happen.
I'm just wondering what it's supposed to, like, where's the guidance here? And
I unfortunately am not gonna be an APHA, and definitely not going, but I wish I was, because that's where I get a lot of the clues from and. a lot of
so
the people
more
that
to
with
follow.
us,
Okay, when is our next meeting?
And there you done with your report? or did you have anything else?
Those just one more thing,
Oh, I'm
so,
sorry.
no, it's good. No, we're almost done. I just wanted to give an update. So we did finish all of our hearings for nicotine free generation. So Wakefield was right in the middle, so we're Wednesday. Melrose did their thing on Thursday. Another good turnout, both sides showed up, did a great job. Since then, we've received a couple of letters, but those are, I think just 2 that we missed right before the meetings because they were submitted way too late. But both from industry folks, distributors. But ever since then, we've had more and more interests kind of gather. People have reached out, they're interested in the policy. And I just thought something more relevant that just came out. There was a study that just showed that smokeless tobacco, they just had a study that showed that there's an increase in liver cancer. And I think it's just one of those things where it's like, unfortunately, the study is timely in the sense that we're discussing this, but now, we're starting to see that, right? But it takes research and policy a few years to catch up to these products that are coming out, right? So I think it's I liked that people pointed out that, several folks in the community talked about alcohol, marijuana, tobacco. But I think, while the pandemic happened and we all sort of took a break in the sense that we did other stuff like COVID, unfortunately, the industry took that as, a time to work without impediment, right? And so unfortunately, I think we have to continue to hit all 3 substances and everything else, including gambling, which we just attended the meeting today for distribution of funds for communities those affected by the expansion of gambling. Right, so, the work never stops, but I think, the good thing about this is that we have concrete data, right? We have concrete data, concrete understanding of how this affects our communities. And I think it'll give us actually a good boost into the next project, whether that's alcohol, whether that's marijuana, it's all gonna happen simultaneously.
In the past, when we have had, my last recollection is working on a worrisome Mark Smoke Shop when we, really the focus was on clean air. And the public participation had nothing to do with the topic. I was very impressed with all speakers on staying on topic and being really, thought-provoking, because there were some just nuances that I had not thought of. So I was sincere when I thanked everybody for coming. And yeah, it's, we're a poly substance, but we can't work on all of them in the same policy. So more to follow.
One at a time, and we really did start to go you know, to take a project along with tobacco when we stopped the sale in, a medical facility and pharmacies. We did a lot, that was a lot. We were, where I was, we were the second community. We took a big bang. It was Boston and then us. We took a lot of hits with it, but we did it. And I think that once Brookline comes out, once we see what comes out of there, then we're gonna see everybody. And once that hits, if it's a go, everyone's gonna go so quick. It's gonna be an adoption for us.
It's interesting, because I spoke to somebody today that works for the city of Melrose, and he actually used to work in pharmacy, and he used to sell when
Yeah.
tobacco was
Yeah,
talked about. It was interesting. He said, oh, the time it was to sell
Yeah.
cigarettes in a pharmacy.
Yeah.
That was gonna be the end of the world, let me tell you. Because we were going out.
Yeah, it's good to stuff out stuff.
But it's good that we started with something, so now I think we're taking it along and we've done all our banning and watched everything, and now we got more data to move to another step.
The only report I've seen in the item was basically reporting on the report to town
Yeah.
council, and
Oh,
it was
Yeah.
written, and it was written fairly without bias.
Yeah, it was pretty good. Yeah.
So that was, I was like,
I think it included our board of health meeting too. I think it mentioned.
it was about time, it said it was about to happen.
Yeah,
So
so,
I haven't
Oh.
read this, we
I read
do them
that, I
all at
read
once.
that.
Okay, anything else?
I'm not seeing anything.
Get more flu and then eventually.
Oh, well, Melissa, quick update. You've been doing a lot of flu clinics. Do you still remember which ones you did? Oh, you're muted, Melissa.
Okay,
Oh, there you go.
done most of the major clinics for Melrose and Wakefield, have all of them left for Stoneham. This year is really interesting. People had asked us about COVID vaccine and whether or not we were going to do it. We were on the fence for a long time, but we decided against it. This year, very late, we found out that the government was not going to cover the cost, and Pfizer would be for vials would be $120 a dose, and Moderna $130. So we just hadn't budgeted that already. So I think we made the ultimate decision to redirect people.
So we need
There's
to.
still
Yeah.
there's still COVID services for homebound people, and other people can get them at their local CVS or their doctor's office. Although CVS, I was just there, and they use technicians. They don't even use nurses.
Yeah, I mean, I am telling you, have you been having this as a prescriber? This is beyond our, beyond our scope, but, being a prescriber, I am seeing, and I am really worried about our retail pharmaceutical industry. They are pushed to the limit, and handing off immunizations to them is that they've got to find a better model, but it's upsetting because, I think we're about to enter a public health crisis with access to pharmaceuticals, quite frankly. We have had supply shortages like we've never seen. But I think it's also important that we spread the word that, because I think, I was waiting for us to do our COVID vaccine thing. I figured, I'm like kind of sad. Nobody other than you guys are giving me my COVID shot. But I think we need to be pretty proactive in that, rolling out that information so that people are proactive in getting to their providers.
I will say a good amount of, we should do more communication on that, but a good amount of people have come to us and said they've already gone and got their
Yeah,
COVID shot. And I think they're
Yeah.
just worried for the season, so they got it pretty early, but.
And we didn't know the pricing at all until
Right.
very, very late. And there's only a few communities that I know of that are going to do clinics. Winchester, for example, they're going to do a clinic,
only
200 dose clinic.
And they're limiting, most of them, as Melissa will tell you, at our recent public health nurse meeting, it has been brought up by local health departments about the decrease in the amount of people that they get for flu
Yeah.
clinics. Because people are going other places, and a lot are going because they can get their flu shot. Yeah, it's going down and down and down, and it's because we didn't allow it, they allowed it, and, you know, started bringing the pharmacist in, which we were not happy about, but to begin with. But you're gonna see, I mean, Costco Drug now has the new COVID vaccine, has a tons of it. Oh, yeah, Costco's, go get your groceries, and you don't have to have a membership, you can just make your appointment and go in.
Oh, good
Somebody
to know.
called me about that the other day.
Can we just go in together and you can get mine? Say, I brought my own vaccinator, just hand me some.
Yeah.
Soda and a vaccine.
Yeah, right.
I know.
I'll drink lunch. I actually saw something today that like kind of infuriated me a little bit. I had to like kind of turn it off. It's on Facebook. I don't know much of Facebook anyways, but a person showing that how their family had gone in, they'd taken a couple of members in and they got their flu shot. And because they got their flu shot, they got these certain type of coupons back. And they had so many of them for so much money off that they couldn't use them all. And could somebody use them? And I'm like, there's the
There's an
incentive.
incentive.
I
And,
was just
and
about
that's
to
what's
say that.
happening. They are.
That's
doing it.
great.
If you're pinging on your phone and you walk into the pharmacy, right, Melissa? People told us the story
Yes.
the other day. Hi, did you get your flu shot? Cause you can get a $25 coupon. Well, heck, I'm gonna go right here and get my flu shot and get
We
$25.
can't compete
you
with
know?
that. Oh, that's
We
great.
And the
Yeah,
fact that they know you're in the store.
Lollipops. We
Yeah,
get
and
something,
Band-Aids, it's not enough, Elaine, it's not enough.
stickers, a smile,
Goodwill.
Yeah,
but we do the assessment when you come to that.
I
room.
know.
We find out what's going on in the community and what the needs are, and we tell them where to go for services. So we're doing our job as a community health.
Well, let's go
Yeah.
make ourselves happy and look at the fabulous pumpkin art that is outside on the front stairs, because they're up till 8.
There is no way a car is getting through, there's no parking.
Yeah, no, I know.
I don't even know where to park.
I parked at home.
Yeah.
Parked across the street, I get here.
Yeah. All right, I have,
Already booked the 15th.
Laurel?
We already booked the 15th,
So
right?
can I ask you guys mentioned Melissa's.
Yeah.
Can I just mention one thing? Catherine is trying to finalize the number of people for the EL night.
Yeah, on
And
that.
so I'm not making any adjustments. Candace, you and Laurel are signed up, but if the number stays as it is, I don't know that we will need either one of you.
All right,
So
let us know.
just
Just let
I'll
us
keep you
know.
posted.
I'll just go anyway.
Yeah, it's 22.
Okay, so what were you gonna ask?
I was gonna ask,
16.
there is a meeting on the 21st for Stoning's Board of Health. That's generally their day is like Tuesday, I think.
Before Thanksgiving.
Tuesday before Thanksgiving. Is anybody planning anything before Thanksgiving? Because if we want to do a joint board meeting, I could ask Melrose Board and see if they want to try to do a November meeting. That would be too huge of a lift, or we do a wait until January, either, it's fine, but we have.
What do you anticipate on the agenda?
I think it could be just a good time to talk about regionalization, like you said. I know Stone just has like a dumpster case, but you know, but it could be interesting to hear another board delivery about a very mundane case that we sometimes get.
Yeah, I mean, I'm available on Tuesday evening, I don't know.
I'm in Boston until 6.
Okay.
Their board is 6:30,
Okay, I could probably.
I don't care.
and if not, we can just do like December or January.
I'm wondering if we should.
It would be in Stoneham?
So we can still pick a place, so they haven't really like.
So then would we still have our monthly meeting?
No, I think this joint board meeting would be in lieu of.
I don't know about you, but I kind of feel that January, like you had suggested,
Yeah.
after flu
Okay, well, in
season,
January.
after this COVID, and then
Yeah.
plus after what we'll hear from
Oh, we can do
Brookline, I think we'll have more
And I
to
think,
talk about, and we'll know more.
I think it would be good to have an intentional agenda,
Yeah,
you know?
When is Brookline slated to next meeting?
Their
next week.
oral arguments are November 6th, I
6th,
believe,
yeah.
and then they will make a decision for another month, at least, if not a month.
Okay.
So you're not meeting in person?
So
I think we are.
I think we are doing the 15th, yeah, just start board.
Let us know where.
Yeah,
This room's
you're gonna be in a mobile unit soon?
Right.
this room's pretty good, and it seems like it's reliable audio and everything. I mean, it's one of the few rooms that are hooked up in town that are like reliable.
Is the community room open yet at the
No.
police station? It's not done yet,
No, the
right?
equipment's not ready.
I have to tell you, if there's public participation, I am old school. We should be, like I almost turned this table around because the people who like how it should be
Right.
is there should be we should be up there in a load of who, the day should be turned around, so if anyone is appealing or needs to discuss something with us, they would take the days and discuss it. And we would elevate this to a professional sort of thing. This way, I'm not like, this is very, I'm just, that's my goal. I don't know if it will ever happen, but in other communities, there is, you know, some decorum around a standard on how you do these
We
meetings.
try hard,
And which has been,
I mean, I feel like in this case, this was two people.
Yeah, it
And I
was
feel like
true.
this may have been a little bit less like
Right, it-
confrontational
Yeah.
with a small.
it's true.
Yeah.
If we were gonna have like, I felt like, you know,
But the middle
last
school
week
was
we
a
had,
speak
that was
unit,
fine,
right?
I thought that worked for that
Yeah.
purpose.
I mean, I think we're allowed to adjust this room.
I suppose if there was a public hearing, we would just turn it around,
Right,
but,
we have chairs.
okay.
Yeah, I mean, we're sort of limited, I mean, WCAT is an option as well,
That's even
Yeah.
although even the studio, yeah, I mean, that's the.
Small, as long as we're not having a huge public, we're okay with
Yeah,
that.
anyways, okay, let's just get to the November meeting, shall we?
Yeah, I'll make a motion to amend the meeting. It's now 7:36.
You wanna amend the meeting to what?
To adjourn.
What else?
I mean, what else?
Hey,
can we do?
wanna talk about Halloween? Let's talk. So my daughter's gonna be.
I don't know. All I know is that the kids in the neighborhood want to know what I got for special, right?
You got special. You give away the big candy bar?
No, I got special presents.
See, look, there's a chocolate shortage.
Yeah.
Okay,
Second to
All in
adjourn.
favor?
Yeah. All right, let a hand.
And I saw one.
Aye, Gorville.
We are done.